They really last your lifetime. The risk is 1 in 10,000 failure rate. And what that means to you is 1 in 10,000 in 10 years, 5 in 10,000 in 50 years chance you need to have them replaced. So when I have my patients come see me, I talk to them about making a long-term decision. Now, that doesn't mean you can't change your implants for reasons of your body habit is changing or pregnancy changes or you're getting weight gain or weight loss. But pretty much what I try to do is your time horizon in the arc of your life is that you're making a choice that you're going to live with for a long time. And what I mean is we're going to do some measurements of your breast, we're going to do some height and weight measurements at your current BMI, and then I'm going to try to find for you your dialed in size of your own desire and how that fits properly to your body habitus. If there's a big disconnection between your desire and your body habitus, I'm going to make sure I talk over the technical features of your breast surgery, the technical features of your body habitus, and what that means is to you is if you're going to go too big, I'm going to try to let you know that you might have mechanical problems. And make sure you know that before you make your choice. We can do certain things now mechanically in your body to add some support material which wasn't available a few years ago. But now we know that a woman who wants big implants, we can do a certain size implant volume and in a few years go a little bigger or just stay with those implants for the rest of her life. I see my patients now at their 5, 7, 10-year intervals. I have patients 17, 18, 19 years post-op, and there's no reason for me to take their implants out unless they've had a mechanical issue.